This is a case of real life of Dr. Fanny Yacaman that you're gonna see here in our office in Beverly Hills. Let me tell you the story of this adorable patient that we became very good friends, and all of a sudden he says, I've been all my life having a good dentistry. That's what he thought. He was going to these clinics that have a huge name in the United States. It's a big change. They make a lot of money because they have to see 45, 50 patients in a day. So no matter how good dentist you are, sometimes they don't give you the time and they say you have to finish this patient in a few minutes. So this is what happened. If there is a difficult treatment and they are not equipped or they don't know what to do and an instrument breaks, then they don't tell the patient. The treatment was okay for a couple of years maybe, until I realized that he has a fistula full of pus coming out of the right side of his gum. And he really cleans his teeth very well. But this is the case where they broke an instrument, and I realized during the retreatment, the instrument cannot come out, but also I had a big image with a microscope, and I was able to see the line of the crack of the root. I told the patient the infection went away, and he said, no, I don't need to do anything, until he had a big, an amount that I will show you right now. So what happened? He comes to the office and he's in denial. Guess what? I don't need to have any treatment, my tooth has been okay, until he got this infection again. This is a fistula, and here comes, this is a little more, the camera, I don't know how the camera can see well, but this is really bad for your health. You can see a little white here. That's the pus that is coming out of that area. And look how clean his gums are. This is the upsetting part for me, that this could be avoided by having a good root canal. Then he's thinking, I don't have any pain. Why should I do anything? Every time I drain here, he was happy to don't do anything else. However, the infection keeps increasing. I saw there was a huge vertical crack on the root when I did the root canal. And then by discovering with my assistant, she showed me this cannula that we use, our catheters. As a good nurse that she is from Philippines, right? She thinks about draining with the way that we, when we have a blood test or anything, and we use a catheter, and this catheter avoid in my hands to open a big incision like we learned, and to drain these abscess of this size, because they can become very dangerous. And with this one that is a little wider, we were able to drain very nice. You can ask your dentist, tell them you see it in our program, that this is another way that you can drain, or simply just push with your hands and start draining your abscess if you don't have an access to a dentist right away. These type of infections also can take you to a septic shock. So the patient is losing bone in the meantime that he doesn't want to do anything, until finally we were able to make a very intelligent decision that I'm gonna show you. So finally the patient said, okay, because I was on and on, let's do it. He had a break of vacation, and let's try to get that space to decide what we're gonna do. The option in here are, before the implant dentistry 30 years ago, we will think how to save the teeth. Nowadays, everybody makes decisions very easy. Take the tooth out and have an implant. How can you tell a patient to have an implant if the patient is willing to spend $6,000 for the implant, $3,000 for the crown, and maybe he has it, and people will say, well, that is more reliable. Well, we don't know, because it can always be rejection. The implants are really good now. There's very few times that it's a rejection. But when it's a rejection to a patient that already have a treatment, spend the money, even if in these clinics was not that expensive. But guess what? Now the quality of life of the patient is affected because he doesn't want an implant and he cannot have the infection. So we have to use the techniques that we have in the old times. Our basic knowledge in dentistry is very important, and that's why your dentist has to give you the time to find options. If you don't want an implant, we have two options. One, we do a mid-section by cutting the half of the root, and then we have to redesign another crown here for the patient. But we have a new crown on the patient already because the crown that he has before was really bad. And finally, when he decided to do the surgery, we decided to cut only a part of the root in a diagonal way. And now we put bone graft, we put a membrane, we suture, and the patient is very happy, and we're saving the patient from having, we have another picture where we see a better design in this area. Now the patient is gonna have instructions how he's gonna floss in that area, how he's gonna brush, and how he's gonna take care of this tooth. So it's a new option, and this is a way to save the teeth. Now you're gonna see what we use after the surgery, how we suture, and the paste we use. And then what happened in this case is when we did the surgery, we closed, we suture, we have a very personalized design for this type of surgery because I didn't want to create any recession on the gums for he has a new crown. And Marie, my assistant, that she is a nurse from Philippines, she doesn't want me to say, but we are an amazing team together. And she came up with this idea that we're doing a periodontal packing, like in perio surgeries. I always wanted to do it, so her and I were talking about in certain patients, it's very important to protect the sutures, because sometimes the patients are pulling the sutures, they don't listen, or they forget and they brush the area. So this is a paste that I'm very proud of the patient, because almost 2 weeks it was in his mouth and it stayed clean. He kept his mouth very clean. But I tell you the important part, this is a patient that watches his nutrition in an exaggerated way. He knows vitamin B12, what is the nuts that he's gonna eat. He knows vitamin C, and the patient healed in an amazing way, even though I was giving some instructions that he wasn't following. But the most important is that he's a very healthy person. He cooperates a lot when it comes to dental pain. And now when we remove the paste and the sutures, this patient has an amazing healing. In a week and a half, I can tell you that it's always seen there's not gonna be resorption on these areas, and now he has instructions to follow. I will give you information on this chapter if you wanna read it. You will see more information about the patient, because also he has a quantum healing channel that you can learn a lot about the way he takes care of his, not only his oral health, but the health in general, and your mind and your body to be in the same balance of your life.